Hi everyone. Hope all of you are doing well. Uh, I'm Dr. Rahul Modi, and I'm here today to talk about a topic very close to my heart about snoring and sleep apnea. Now, although very common condition, I think we all know someone who snores and snores loudly. Ever wondered why we snore? Ever wondered why do some people snore? So, with the idea of creating awareness about this condition, or what we medically call as sleep apnea, and to clear a few doubts perhaps, I'm making this video. I'm an ENT surgeon. I'm especially trained to treat patients with snoring and sleep apnea, and I hope to create awareness through this. So, snoring, I think nobody is proud of their snoring. However, nobody was worried about this snoring from the medical perspective. Most people, I would say, till not so long ago. It used to be always thought of as a social nuisance more than anything else. It's only in the last few years that scientists started thinking, last few decades, as to how and why do we snore. Now, typically, when we have to produce sound, we have to create an obstruction to the airflow, and that's how we whistle, right? You have to create a purse lip. It requires a lot of effort. And unobstructed breathing, like try and whistle with a wide open mouth, you won't be able to because you have not created enough turbulence. Similarly, try and snore in the sitting position and try doing that for more than 5 minutes. You will realize that you are quickly getting exhausted. And the same phenomena is happening for that person who's snoring loudly in the sleep throughout the night for sometimes hours altogether. And how do you think that person is going to wake up? Not very fresh, right? The person is actually exercising and wasting energy, so to say, when he is supposed to be resting and being calm. When we look at the airway, the breathing should be free without any hassle. This is how even the snorer breathes, mostly during the day. However, this is how the transition happens when the person goes off to sleep. There is some either issue with the nose, sometimes issue behind the nose, sometimes issues with the tongue or behind the tongue. The reasons are different for each individual, but the presentation is the same, is a loud snore or may not be such a loud snore, but some sound while breathing when the person falls asleep. The differentiating factor is that the person won't have any sound of breathing when he's awake, won't have any sound of breathing when he is lying down. Sound only starts when the person transitions to sleep. Now, what do we see commonly as the reason for this sound to develop? It could be that the person having chronic nasal issues leading to a nose block, to compensate for which the person sleeps with an open mouth, which leads to a tongue fall and worsens the obstruction in place of improving it. The person could be an overweight individual. Close to 50% patients with sleep apnea may have weight issues, and they may have a bulky tongue, fat deposition around, which leads to the narrowing. Fat deposition around what we call as the palate can lead to these problems, and enlarged tonsils, amongst other reasons. Enlarged tonsils are a very common reason. Enlarged tonsils and what we call as adenoids behind the nose in children especially. Now, medically, we like to define snoring or troublesome snoring or sleep apnea as a condition in which there is recurrent collapse of the upper airway, that is airway starting from the tip of the nose going all the way till your voice box, resulting in substantially reduced or complete cessation of your ongoing breathing efforts, leading to what we call as obstructive sleep apnea. These are events which happen only during sleep, leading to cessation of breathing. Now, what happens if the person is continuously exercising in the night, or struggling to breathe, he will have a fragmented sleep, which leads to the person not feeling fresh in the morning, not feeling fresh or rested during the day, not able to concentrate well. You have a 35, 40-year-old who feels like a 65-year-old, who feels that every day is a drag, who may be irritable, who may feel that, he's losing it, may feel like he's having some kind of vitamin deficiency. Very common. And the other thing that we worry as doctors is the rapid fluctuations or the intense fluctuations that happen in the oxygen levels in the night, which are not good for your heart. So, which are responsible for all the cardiac issues that one may face because of untreated severe snoring or severe sleep apnea. Very common condition in children too. However, I will be discussing that in a separate video. However, just a point to note is patients who suffer from sleep apnea have a high chance of having kids who may snore. Kids who snore may have a higher chance of having either of the parent snoring. So please do look out for a generation above you and a generation below you if you are yourself diagnosed with sleep apnea or you suspect that you may have sleep apnea. Now, the other point that I would like to mention is why treating sleep apnea is important, because it's a condition which is very common in patients with cardiac condition. So not only that sleep apnea can cause cardiac issues, a significant proportion of patients with cardiac issues may have sleep apnea. So if you or your loved one is suffering from any of these conditions, do check for symptoms of sleep apnea. If somebody is having high blood pressure, congestive heart failure, type 2 diabetes, atrial fibrillation, other forms of hypertension, this is a prevalence of sleep apnea in these health conditions. And how common is this condition? What prompted me to kind of like do this video? Two data points. It is estimated that close to 1 billion, that's billion with a big B, suffer from sleep apnea, with some countries, more so I would say European countries, having incidence as high as 50%. Every alternate person in the population having some degree of sleep apnea. More so when I look at the freshly studied Indian population, a study done at AIIMS Bhopal by Dr. Goyal, which showed that more than 30% of the population having moderate to severe sleep apnea. So it is not as uncommon, rare, hidden problem. It's out there for us to see, identify, and treat. So how can one know if they have sleep apnea? Simple self-screening acronym, which is the Stop Bang questionnaire. Look for signs of loud snoring. If you're not feeling fresh in the morning, if you've observed or somebody has observed that you are gasping for breath in the night, if you suffer from high blood pressure, if you are overweight, that can be measured through your BMI or body mass index. If you're above 50 years of age, you have a high risk. If you have a thick neck or male gender. Now, if I have just more than 3 points, then you may be at a high risk for sleep apnea. So, for example, if you snore loudly, have blood pressure issues, above 50 years of age, and a male gender. So, a 50-year-old male who's snoring and has some blood pressure issues, that's good enough for you to suspect sleep apnea and get to the next step. Now, typically, the first step that your doctor would advise after examining you, after checking for all the issues that we mentioned earlier, including sinus issues, tongue issues, after examining your upper airway, they will order a sleep study, which essentially involves monitoring various parameters in the night. It can be done through a simple home sleep setup. However, in certain special scenarios, we may ask for a detailed sleep study, sleeping in a sleep laboratory or in a hospital setup. We typically monitor your oxygen levels, your breathing patterns, your heart rate. That's the bare minimum that is monitored. Along with that, in special scenarios, your brain waves may be mapped to know the sleep staging. Your muscle tone may be mapped. Your position sensors and other things, snoring intensity may also be charted. And once the sleep study is done overnight, within a day or two, you will be issued a report like this. Now, this may be an overwhelming affair for majority of patients. Hence, I would like to break down the sleep study for you. It would have typically two important components. So we look at apneas, which are complete cessation events, or we look at hypopneas, which are partial cessation events. So here, if you see in this study, there are 535 total events, which translates into 93 times every hour. So those are the number of potential snooze alarms this person is hitting in the night. So that's like one every 40 seconds or so. We look at the positional data. We look at the oxygenation data. I'll explain the relevance of positional data a little later. But the relevance of the oxygenation data is that if this number is below 88%, which means their oxygen is reduced to dangerously low levels, and if this number is more than 9, typically this should be 0 in a healthy individual. But if this is consistently above 9 minutes, then it indicates that your heart is under potential stress and is prone to developing all the list of cardiac issues that we discussed earlier. We also look at what we call as a hypnogram to look at the quality of the sleep study and the various obstructions that may be there. And because these obstructions are more than 30 in number, this individual gets labeled as someone with severe sleep apnea. Now, why do we like to treat it? One could be that the bed partner is objecting, her sleep or his sleep is getting affected. The person may not feel fresh in the morning, or may have multiple or be at risk of multiple cardiac issues, especially someone with the sleep study that we just saw is definitely at a risk of developing a lot of cardiac issues and needs early intervention. Now, going forward, the most commonly prescribed treatment for sleep apnea will be what we call as continuous positive airway pressure therapy, which is actually a very remarkable therapy, a simple to use therapy. You sleep with a mask, there are better masks available, which essentially pushes air through the nose, keeps the airway open, and allows that person to have an unobstructed airway, relieves the obstruction, relieves the events, and typically the patient would wake up after getting adjusted to a machine over the next few days with feeling fresh. Now, the good part of the treatment is it really works. The challenge here, although, comes that it only works as long as you use it. So, may not be an exciting proposition for everybody who's suffering from sleep apnea, but patients who are able to use it really feel a lot of difference. Quick mention about positional sleep apnea. We mentioned about the position data that is captured by the sleep study. Typically, we see this in mild diseases where the numbers are below 15 events per hour, where just by sleeping in the lateral position or in the sideways position, the person is able to relieve. Here you can see a small pillow which is ensuring that to happen. These are positional devices which are easily available online. One may use it to ensure that one tends to sleep more on the lateral side. However, this is not very commonly seen, especially in patients with moderate to severe sleep apnea. Now, when we start treating patients with CPAP, we start seeing changes pretty soon. Within a few days, the person will have improved alertness, refreshing sleep, mood becomes better within weeks of usage. We get optimal blood sugar control, and studies have shown that the component of sleep apnea in worsening blood pressure tends to get neutralized in a matter of months. However, patients who are unable to use CPAP or who do not want to use CPAP may prefer alternatives if they are eligible for the same in the form of either oral appliances or minimally invasive surgeries. These are scar-free surgeries which require you to get admitted in the hospital for a couple of days, and typically after discharge take about up to a week to heal and everything. However, the bigger advantage here is you can potentially take the patient off CPAP for the rest of his life. However, weight loss forms a very important part of this therapy, especially if the patient is grossly overweight. Positional therapy works very well for patients with significant positional component. And there is new emerging research evidence to suggest that myofunctional therapy, which are essentially tongue exercises for the upper airway, which will help in creating a stable airway. Role of drugs in sleep apnea is still being investigated. We don't have research proven molecules as of yet. There are some drug trials in place, so we hope in the near future we'll be able to option or give the option of drugs to our patients. However, currently there are not many promising drugs which are, so to say, FDA approved or something that can be offered to our patients. With that, I would like to thank you guys for being such a patient audience. I'll be happy to know in the comment section. Do let me know if you need me to prepare some specific videos about different topics. I look forward to interacting with you on this topic. Thanks, Tan.